for anything and everything that you want to do, you want to be well prepared, especially for something like proning. Proning is a team activity. This is not an individual thing. You need a good team, a ready team to be able to effectively prone a patient. So first and foremost, decide that you want to prone a patient. Consider any contraindication that may be present. If you have ruled out all the possible contraindications and you've decided to prone a patient, then the advice is to ideally prone the patient within 1 hour from the time the decision is taken. Now, you've got the PF ratio, you've decided to prone the patient. Next, and equally important, is to explain this to the family. Why? Because if a family, and not just the family, a patient, if the patient is awake. Imagine somebody is, only mildly sedated. He's been lying supine, wakes up on his stomach, unable to move, can't open his eyes because there's full facial edema, eyes are puffy. Can you understand how scary and anxious that it will be for that patient? So it is very, very important that if the patient is conscious or will be conscious during the patient proning procedure, the patient should clearly be explained about the procedure and what he will go through. Similarly, it's very important for the family to be told, because often once you prone a patient, especially if it's a long duration, 18 hours, it's the second, third, fourth cycle of proning, patients end up with a lot of facial edema, orbital edema. They may not be able to open their eyes. And some of them, in spite of best efforts, could end up with pressure sores. These pressure sores can be ulcers on the nose, it can be ulcers on the chin, it can be ulcers on either cheek or on the rest of the body. It is very possible that these things can really scare patients. So it's important to make them understand what they're signing up for. Now, once we've got all of this ready, we go to the patient. With regards to the feeding, proning is not a contraindication to enteral feeds. Patients should be fed during proning. The only time that they should not be fed is prior to proning, during proning, immediately after proning, and the same when it comes to supining a patient. The reason is the process of proning can induce vomiting, and at that point it can induce an aspiration. So just before you decide to prone a patient, stop the feeds. If possible, aspirate the feeds from the Ryle's tube or any feeding tube that you're using, and cap the tubes. Once you've done this, the most important part is the endotracheal tube. Now, in a prone position, first of all, proning itself can dislodge the tube. And second is, when the patient is lying in the prone position, the head is kept semi-flexed. So it is possible for the endotracheal tube, if it is sitting on the edge of the carina, for it to actually go into the right bronchus. So very important is to do an X-ray, confirm the position of the tube. Ideally, it should be 2 to 4 centimeters above the carina, which gives enough room for the tube to move, even if it does descend a little bit. Once you've confirmed the position of the tube, secure the tube firmly. Now, the person who's going to be at the head end of the bed is going to be the doctor or the respiratory therapist responsible for proning. He should be very, very confident of that the tube is secured. The lip level should be noted, and not just the tube, but all peripheral and central lines and catheters should be firmly secured. Please understand, you're taking a patient who's lying supine, turning him over onto his stomach. No matter how prepared you are, there will be some dragging, some pull that will happen. Lines and tubes should be firmly secured. Do a very thorough ET suction prior to proning and immediately after proning. Like I told you, proning is a team job. So yes, the person at the head end of the bed, the doctor, the person who's taking all the decisions, maybe only one, but the team needs to know what they are doing. So for example, if I decide to prone a patient, I have to be clear, am I going to move the patient rightward or leftward? I will go, as I explained, you'll understand why this direction is extremely important. Now, once you've prepared, you have to assemble things. What are the things you have to assemble? Now, a prone patient is at an extremely high risk for pressure ulcers. So everything that we can do to prevent these pressure sores should be done. You can use gel pads, you can use foam pads, you can use Maplex, you can use water-filled gloves, and you'll need anywhere between 6 to 8 pillows. Next is assembling the manpower. Ideally, a team of 5 of people who are experienced or at least exposed to proning. But if that's not available, that is fine. The doctor or one person who's well experienced should suffice. There are some even videos and guidelines which recommend up to 7 people for proning. Yes, that is ideal, but in the COVID era, you want to restrict the number of personnel in the room. So the guideline is to limit it to 5 people. I will go on to explain the position of these 5. Very to take into consideration is how you prepare all the IV lines and tubings. Now, the simple dictum to remember is you take everything at the waist. Whatever is above the waist points up. Whatever is below the waist points down. So you take all the lines and tubes which are present above the waist, add extensions and secure them and have them all pointing upwards. So if any fluid or pump is being used for anything that is going in the part of the body above the waist, these pumps are kept at the head end of the bed. If there are lines, tubes which are being used from below the waist, they are secured and the pumps should be placed at the foot end of the bed. All of these will help when you prone the patient.